Welcome to another episode of Med Madness, your go-to podcast for comprehensive medical education. Today we'll be diving into an important topic for all medical students and professionals, postdural puncture headache. This condition, often encountered after lumbar puncture or neuraxial anesthesia, presents unique challenges in both diagnosis and management. In this episode, we will explore the definition, causes, symptoms, diagnostic methods, treatment options, and a real-world case study to enhance your understanding and preparedness. Next, let's discuss what this condition is. Postdural puncture headache, commonly occurring after lumbar puncture or neuraxial anesthesia, is a type of headache resulting from unintentional dural puncture. This puncture causes cerebrospinal fluid, CSF, leakage, leading to low CSF pressure and slight herniation of the brain and brainstem. The resulting headache is positional, typically worsening when the patient is upright and improving when lying down. The primary risk factor for this condition is the procedure itself, whether for diagnostic or anesthetic purposes, making it a crucial consideration for clinicians performing these interventions. Next, let's discuss the symptoms and clinical presentation. Patients with postdural puncture headache usually present with a headache that begins within 72 hours after the procedure. The hallmark of this headache is its positional nature. It worsens when the patient stands or sits upright and alleviates when they lie down. In addition to this, patients may experience neck stiffness, photophobia, diplopia, hearing loss, and tinnitus. These symptoms can significantly impact a patient's quality of life, making prompt recognition and management essential. Moving on, let's talk about the diagnosis of postdural puncture headache. Diagnosing this condition primarily involves a thorough clinical evaluation. The key diagnostic feature is the positional nature of the headache. A detailed patient history and physical examination are critical. In some cases, imaging studies such as MRI or CT scans may be used to rule out other causes of headache and confirm the diagnosis by visualizing CSF leakage. Now let's explore the management and treatment options for postdural puncture headache. The management of this condition often begins with conservative measures, as most cases are self-limited. Patients are advised to rest and stay hydrated. For those with severe symptoms that interfere with daily activities, an epidural blood patch is the treatment of choice. This procedure involves injecting a small amount of the patient's blood into the epidural space, which helps to seal the dural puncture and alleviate symptoms. Complications from untreated postdural puncture headache can include chronic headaches and, rarely, subdural hematoma, highlighting the importance of timely intervention. Next, let's consider a real-world case study. Imagine a postpartum patient who recently underwent epidural anesthesia and now experiences a severe headache. The headache worsens when she sits up and improves when she lies down. Alongside the headache, she has neck stiffness and photophobia. Given the recent epidural procedure and the positional nature of her symptoms, a diagnosis of postdural puncture headache is made. Conservative management is initiated, but due to the severity of her symptoms, an epidural blood patch is performed. The patient experiences significant relief, illustrating the effectiveness of this treatment in severe cases. In summary, postdural puncture headache is a condition that requires prompt recognition and appropriate management to prevent complications and ensure patient comfort. Early diagnosis, primarily based on clinical presentation, and effective treatment, including conservative measures and epidural blood patch, are crucial. As you prepare for your medical exams and clinical practice, remember the importance of understanding conditions like this. Don't forget to engage with our pre- and post-podcast quizzes and utilize the Anki flashcards for effective study and retention. Thank you for tuning in to Med Madness, and we look forward to exploring more medical topics with you in our next episode.